Okay, so chapter 54, we're going to get started on page 1344 with intradermal injections. Now, I don't have you muted, Danielle, but if for some reason you need to, mute yourself, feel free to. Okay, good. If you have any questions, though, either unmute yourself or just wave or something, okay? So intradermal injection, the abbreviation is ID, and it is used for allergy skin testing. Now, there is a difference between intradermal, there is allergy skin testing, and then there is TB skin testing. The site for the TB skin testing is the forearm. The site for the allergy skin testing is going to be either on the back or the chest. Okay, so that is the difference between the allergy. They're both the same route, right up under the skin, but just different sites. It is within right up underneath the layer of skin. Common sites to perform the intradermal injection include the upper chest and the upper back, as well as the anterior forearm. So your anterior forearm is this here. Okay, you have two of them, right and left. So can you tell me, what is it called whenever you give a TB skin test? What are the two terms that can be used to describe the thing that comes up on the arm?
Wouldn't that be like the little, that's the one that's the ball?
What's it called?
A ball. Let's see.
There's two words. Starts with a B, and the other one starts with a W.
The wheel.
Wheel and
the
bleb.
The who?
Bleb.
Yeah, I didn't know that one.
Okay. All right. So if you hear those two terms, that's what it's referring to. Okay. So that is what happens when the medication is administered under the skin. Now, if you have a positive test, you should not have a 72 hours later when they have to come back to read it. The patient should not have a knot or a raised area on their arm. Okay, see the difference? Okay, so the bleb or the wheel is when you administer the medication, not when you come back to read the test. The tuberculin skin test, the abbreviation for that is TB. T is in Tom, B is in boy. It is administered intradermally. The test does not determine if the infection is active or inactive, meaning latent. So there are two indications that must be positive to know that a patient has an active case of tuberculosis. One is going to be, it's not going to be the skin test. If the patient has a reactive skin test, the doctor will order a chest x-ray and then a sputum culture. Both of those have to be positive for a patient to have an active case of tuberculosis. Okay, so if a patient has a reaction, a positive TB skin test after it's administered, does not mean that the patient has tuberculosis. It can mean that they have come in contact with this disease. They could be a carrier, but it does not mean that they are active. Okay. If a patient does have a positive skin test, they can no longer receive the injection. They will always have to get a chest x-ray. Okay. And usually all medical field jobs require either a TB skin test or a chest x-ray once a year. So if a patient can't do the TB skin test, then they have to go do a chest x-ray, and the employer has to pay for it, not the employee. Okay. You will also hear the TB skin test be known as or referred to as PPD skin test. And the meaning of that is the purified protein derivative. That's in the bottom of the page. You see it. Okay. Or the MAN2 test. The MAN2 test is the TB test. So it's called different things, but it is the same. I'm now going to the top of the page of 1345. Whenever you are going to administer a TB skin test, have you done this in lab yet? Yes, yes, or no?
Yes.
Okay. All right. So whenever you are doing a TB skin test, you do need to make sure that you're doing it in a clean area and there's no tattoos. Some people that have the full sleeve tattoo, it's unavoidable. It's okay. But you try to do it in an area that will be well visible whenever the patient returns for it to be read. Okay. It needs to be cleaned with an alcohol pad, and the alcohol needs to dry because it will burn whenever you are injecting the patient's arm and it hadn't had a chance to dry. It can also cause the test to be inaccurate results. It can alter those results. So whenever you get down to the TB skin test results in the second paragraph, the first bump or a firm, it'll be kind of like a knot. And sometimes it'll be red and sometimes it will not be red. Is a positive reaction to the test. Again, that does not mean that they have tuberculosis. This that they've had a reaction to your test. The size of the firm bump is measured using it will be measured in centimeters, and they make specialized measuring tapes for those. You've seen the centimeter measuring tapes?
Yes.
And that will be documented. The date that you read it, the time that you read it, your initials, and the size of the bump. Okay, that is the first step. The next step is for you to report the positive findings to the physician. So then the physician can therefore decide on what further either treatment, testing he or she wants to do. So I have, I bought one of our little skins from the lab home. And I just wanted to show you, Danielle, ladies, these are the different syringes, needles that we have. So can you tell me, can you see the difference in the sizes?
The blue looks like it's the biggest. The one in the middle looks the shortest, and I guess the one on the end is oh, okay, I can see it now. Okay.
So the difference in this is a TB syringe. These are insulin syringes. Your insulin syringes are always going to have the orange cap. That's the difference. We'll get into the difference with the insulin syringes later. Okay, there is a difference in the two of those. But what I really wanted to point out with your TB syringe, this one is blue. I do have medicine in it because I wanted to show you how to do a TB skin test. It did have a blue cap on it like this. Okay. Your TB skin test needles will also come in a package that has no needle sometimes. And sometimes your offices will order them separately. And your needle is going to be a 27 gauge needle. It will be gray. The tip of it will be gray. So once you have clarified your order, and you have your supplies. I have all of my supplies here that I'm going to need to administer a TB injection. I have my patient, okay? I have my medicine that I have pre-drawn. I'm going to show you what I have drawn up shortly. I will have 2 alcohol pads, 1 to clean your vial and 2 to clean the patient's arm. So you always want to clean the top of your vial. They will come in multi-dose vials before you draw anything up. Also, do you notice something different with this needle that most needles or syringes? Does it have a safety on there?
No.
Okay. Can you change your needle?
No.
No, that's the difference. So the needle is so small that it's not going to hurt the patient not changing your needle. Okay. So because like with intramuscular injections, you want to change your needle out because it's going to dull the tip of that needle and it's going to hurt. You ever got an injection with a dull needle? And it feels
No.
like to jam it in your muscle? And trust me, you have some mean old crews out there that does it on purpose if they don't like you. They do. So, okay. So I'll bring this closer to you. Can you see the numbers on the syringe?
All the way to 8.
Okay. It goes all the way up to 1 cc.
Okay.
So I have 1.1 drawn up here. Can you see the bottom of the plunger?
Yes, ma'am.
Okay. So that is the amount is 0.1 that you will draw up to administer to give this TB skin test is 0.1. So you're going to take your alcohol pad. You're going to clean your patient's arm. I like to do a TB skin test on a flat surface and kind of get parallel with your patient because it's easier, it's going to be easier whether you're right-handed or left-handed to get on that side. You want to have your patient, you don't want the patient's arm flopping around in the air. Okay, you want them to have their forearm laid on a flat surface. And that way it's going to allow you to have stability with your needle. It's going to allow or prevent your patient from pulling back because some patients are really, really terrified of needles. And when you come at them with a needle, they're like, I'm not having that, and they'll yank from you. So if you make them lay their forearm on a flat surface, that'll help with that. And when you're cleaning the patient's skin, you want to take your alcohol wipe just like you're doing a venipuncture. You're not going to go in a circular motion, or you can. Let me rephrase that because I don't want to misconstrue you. Okay, you could do the circular motion inward out, and then you discard. Or with a TB skin test, and only your TB skin test, you decide that you're going to stick. You can do 1 swipe up, okay, and let it dry. But don't go back and forth. Don't go side to side in circular motions like that. You're either going to do the 1 swipe up or the small circle inside out, okay? So then I've taken my cap off of my needle. See, the needle is, you can't change that needle out. It is embedded in that syringe. Okay. So whenever you are administering it, you have your patient sitting in front of you. The bevel of your needle should always be up. Okay. So I've got my area cleansed with alcohol. It has dried. And so I'm going to try to do this. I may have to stand up so that you can see. Okay, so I've got the skin, and My is bevel up. Okay. Are you having a hard time seeing me?
Okay, there you go.
Okay. So I like to put my fingers down on the table for leverage. And you want to hold your needle just like this. You don't want to hold it like this, and you don't want to do it like that. You're only going to go right up underneath that top layer of the skin. Okay. So your angle it's kind of like you're angling, you're lining your needle up with your patient's skin, just like that. I don't know if you can see the needle. Okay. So I've got my needle, I've got everything ready. So all I'm going to do is gently, with one slow motion, after cleaning it, once you have the needle inserted, you can gently pull you should still be able to see the tip of your needle under the patient's skin. I've got it in there. Now, if I wasn't using my other hand to hold our skin, now I'm just going to inject. And I don't know if the clarity is good for you. Once you have the medicine injected, you pull out and you're going to just immediately discard your needle.
Okay.
Can you see the bleb?
Yes, ma'am.
Okay. I'm going to set it aside, and I'm going to put my cap on here so that I can properly dispose of it. Now, and the patient will need to come back 48 to 72 hours once it's been administered to be read. That's why it's very important to put your dates and your time and your initials, because you may not be there the day that the patient comes back to have their test read. So whoever reads it needs to have that information of who gave it, okay? Because I know if a patient comes to me and they say, oh, I need my TB skin test signed off on, and they just show me their arm, but they don't have a form and it's not filled out, I won't sign it. So all of that information needs to be completed, and the person that gave the injection needs to have it initialed, and they need to tell that patient when they need to come back to the clinic. When I was working at nursing homes, if my CNAs would not come back to me within that 72-hour window, they were required to get another TB shot. So you can't assume that if they don't come back to you that they have a negative test. So they have to come see, even if it, I would leave maybe the form with another nurse. If it happened to be the weekend or something, I would leave it with the charge nurse at the nurse's station. And that brings up a very good point. So if a patient comes into a clinic and it's a Thursday, they're not going to be able to come back to the clinic within 72 hours to get their TB skin test read. So there will be certain days of the week that the patients are allowed to come in for a TB skin test. Any questions?
I have one.
Okay.
What if a person has like a rash or eczema in that forearm? Are they still allowed to do that test?
Very good question. They are allowed to do the test if they have an active outbreak. I would, you have from, the forearm, that whole area, to administer that injection. However, if the rash is severe and it is inflamed, I probably would not. You can ask them if they are undergoing treatment for eczema. Sometimes if a person has an allergic reaction, if they have sensitive skin, I would say ask the provider that you're working with to make sure that it's okay for you to administer that TB skin test. But should have 2 forearms. There are some incidences where they don't. And you even have some that don't have forearms if they were born with an abnormality. So then what do you do? So sometimes on patients like that, your physician will just order a chest x-ray. Got it?
So don't, yes, so don't inject that anywhere else. Okay.
No, I wouldn't. So 48 to 72 hours from the time of being administered to come back to be read. And a reactive test does not mean that a patient has tuberculosis. It just means that they have had a reaction to the PPD medication. One other point that I'd like to make whenever you're doing the TB skin test, you don't want to put a Band-Aid, a bandage, or rub. You want to tell your patient not to scratch the area. That medication will absorb and the bleb or the wheal will go down. That medicine will absorb into the skin. If you put a Band-Aid on it, the Band-Aid is going to absorb that medicine and their test results may not be accurate. You don't want to give an alcohol pad. Same thing. It could absorb the medicine. If your patient scratches or manipulates the site that the TB skin test was given, it can give an inaccurate result. It can give a false positive. So all of those things are key things to remember whenever you're doing your patient education for a TB skin test. Okay. All right. Let me stop this recording. I hope you got something out of it.